আসসালামু আলাইকুম এবং আদাব। আমি ডক্টর দেবেশ রংপুর মেডিকেল কলেজ থেকে 2015-16 ব্যাচের স্টুডেন্ট। আমি হচ্ছে রংপুর মেডিকেল কলেজ থেকে গ্র্যাজুয়েট করেছি 2021 এডিতে। এবং হচ্ছে এখন আমি নেপালে আছি। আমি হচ্ছে রিসেন্টলি অক্টোবর 2023 অক্টোবরে ইউএসএমএল স্টেপ 1 দিয়েছিলাম। তো সবচেয়ে আগে আমি অ্যাক্সিস মেডিকেল পরিবারকে ধন্যবাদ জানাতে চাচ্ছি আমাকে এই অপরচুনিটিটা দেওয়ার জন্য, যে আমি আমার নলেজ এবং প্ল্যাটফর্মটা আমি আমার নলেজটা এই প্ল্যাটফর্মে শেয়ার করতে পারবো। তার জন্য অনেক অনেক ধন্যবাদ। আমি আগেও অনেক ক্লাস নিয়েছি, কার্ডিওভাস্কুলার সিস্টেম, এমব্রায়োলজি, অ্যানাটমি, ইন্ট্রোডাকশন, তারপর হচ্ছে একটা ইউএসএমএলই ওরিয়েন্টেশন ক্লাসও নিয়েছিলাম। আজকে আমাদের টপিকটা হচ্ছে ফিজিওলজি অফ কার্ডিওভাস্কুলার সিস্টেম। ফিজিওলজিটা কনসেপচুয়ালের জন্য অনেক ইম্পর্টেন্ট। যদি আমরা ইউএসএমএলই অ্যাসপেক্ট থেকে দেখি, তো হচ্ছে ফিজিওলজি এবং প্যাথোলজি সবচেয়ে ইম্পর্টেন্ট। অ্যানাটমিটা অত ইম্পর্টেন্ট না। ফিজিওলজিটা অ্যান্ড ফিজিওলজি অ্যান্ড প্যাথোলজিটা খুবই ইম্পর্টেন্ট। তো ফিজিওলজি অফ কার্ডিওভাস্কুলার সিস্টেম আমি 3টা ক্লাস মধ্যে শেষ করব। আজকে একটা, তারপর এরপরে 2টা ক্লাস থাকবে। সেকেন্ড ক্লাসের মধ্যে থাকবে আমার হচ্ছে কার্ডিয়াক সাইকেলের নিয়ে কথাগুলা। আর তারপরের কার্ডিওভাস্কুলার ফিজিওলজি ক্লাসে থাকবে আমার রেগুলেশন অফ ডিফারেন্ট প্যারামিটার্স অফ কার্ডিওভাস্কুলার সিস্টেম, এটা। তো আজকে আমি বেসিক প্যারামিটার্স গুলা ডিসকাস করবো কার্ডিওভাস্কুলার সিস্টেমের সিবিএস তে, যেগুলো লাগবে আর যেগুলো কনসেপ্টের জন্য অনেক ইম্পর্টেন্ট. If you don't understand those topics, then it will be really hard for you to grasp the concepts of other topics related to this topic, related to this physiology of cardiovascular system. So, without further ado, I would like to start. আপনারা যেখানে দেখতেছেন, যদি বাংলাদেশে আসেন না হলে বাইরে আসেন, আশা করি যে আমার এই অডিও এবং ভিডিওটা ক্লিয়ারলি আসতেছে এবং আমার স্লাইডগুলো ক্লিয়ারলি আসতেছে। আমি আমার আজকে এই ক্লাসে ফিজিওলজি অফ কার্ডিওভাস্কুলার সিস্টেম, তার মধ্যেও স্পেসিফিক প্যারামিটার্স অফ কার্ডিওভাস্কুলার সিস্টেম ডিসকাস করব। তো উইথাউট ফার্দার ado, I would like to start. তো আপনারা দেখতে পারতেছেন কিছু টার্মিনোলজিস গুলা আছে, যেগুলা অনেক ইম্পর্টেন্ট কার্ডিওভাস্কুলার সিস্টেমের জন্য। এগুলা হচ্ছে কার্ডিয়াক আউটপুট, কন্ট্রাক্টিলিটি, প্রিলোড, আফটারলোড, অ্যান্ড কার্ডিয়াক অক্সিজেন ডিমান্ড। আমি এই টপিক গুলা হচ্ছে স্টেপ ফার্স্ট এড স্টেপ 1 থেকেই নিয়েছি। এটা আর কোথায় থেকে না, শুধু আমার সোর্সটা হচ্ছে, আমি এটা মেনশন করতে চাই যে আমার স্টেপ 1, ফার্স্ট এড স্টেপ 1 থেকেই নেয়া এই টপিক, সব টপিক গুলো। তারপর হচ্ছে আমি উইদাউট ফার্দার ডু স্টার্ট করতে চাই। স্ট্রোক ভলিউম, আগে হচ্ছে আমরা কার্ডিয়াক আউটপুট ডিসকাস করি। কার্ডিয়াক আউটপুট জিনিসটা কি? তো কার্ডিয়াক আউটপুট মানে হচ্ছে ভলিউম অফ ব্লাড পাম্পড বাই হার্ট ইন 1 মিনিট, ইটস কল্ড কার্ডিয়াক আউটপুট। সো কার্ডিয়াক আউটপুট বেসিক্যালি হচ্ছে হার্ট 1 মিনিটে কতটুকু ব্লাড পাম্প করতে পারে, এটা হচ্ছে কার্ডিয়াক আউটপুট। এখন কার্ডিয়াক আউটপুটের একটা ফর্মুলা আছে। কার্ডিয়াক আউটপুট ইকুয়াল স্ট্রোক ভলিউম ইন্টু হার্ট রেট। স্ট্রোক ভলিউম মানে হচ্ছে ইচ বিটে হার্ট কতবার পাম্প করবে, কত ভলিউম পাম্প করবে, ওটাকে বলা হয় স্ট্রোক ভলিউম। অ্যান্ড হার্ট রেট মানে হচ্ছে ইচ মিনিটে হার্ট কতবার বিট করে, এটাকে বলা হয় হার্ট রেট। সো স্ট্রোক ভলিউম টাইমস হার্ট রেট ইকুয়ালস কার্ডিয়াক আউটপুট। তো আমি যদি প্রিসাইজলি বলি, তো ওয়ান স্ট্রোক ভলিউম ইজ অ্যাপ্রক্সিমেটলি ইকুয়াল টু 70 মিলিলিটার্স। অ্যান্ড অ্যান্ড এক মিনিটে হচ্ছে হার্ট রেট 60 to 100 বিটস পার মিনিট বিট করে। যদি আমি এভারেজে বলতে চাই, তাহলে এটা হচ্ছে 72 বিটস পার মিনিট। তো যদি আমরা অ্যাপ্রক্সিমেটলি মাল্টিপ্লাই করি 70 into 70, তো it comes somewhere around 49 or 5 liters. So cardiac output is approximately 5 liters. So cardiac output, let me revise this again. Cardiac output equals stroke volume into heart rate. Stroke volume approximately equals to 70 milliliters. heart rate approximately equals to 72 beats per minute. So if you multiply those topics, you will be getting cardiac output equals 4.9 liters or 5 liters approximately. So cardiac output. So cardiac output basically, there are a few parameters which affect cardiac output, or let's say stroke volume. They are contractility, preload, and afterload. If contractility increases, then of course, heart will pump more volume of blood. That is the stroke volume will increase. Also, mm, um, if preload increases, cardiac output increases, and if afterload decreases, cardiac output will increase, or stroke volume will increase. I will discuss about preload and afterload, contractility, preload and afterload subsequently. So cardiac output, I hope you got the concept of cardiac output. It's quite important. Now let's talk about contractility. Um, Contractility is nothing but its ability of heart muscles to contract, মানে হার্টের মাসল কতটুকু কন্ট্রাক্ট করতে পারে এটাকে বলা হয় কন্ট্রাক্টিলিটি. সো contractility, it's like it's a kind of inotropic action, like inotropic potential of the heart muscles. Greater the contractility, greater the stroke volume, and so if stroke volume increases, cardiac output will also increase. So contractility, there are some factors which increases contractility. For example, catecholamines stimulate contractility via beta 1 receptors. Also, increase intracellular calcium will increase contractility, because calcium is ultimately needed for contraction of striated muscles of heart. Mm. Also, sodium, extracellular sodium. Amount of extracellular sodium regulates calcium sodium pump, which is situated in sarcolemma of cardiac myocytes. So, যদি sodium বাড়ে, then there will be more functioning of sodium calcium channel, which will result in more influx of calcium into the cell and outflux of sodium. So, if extracellular calcium if extracellular sodium decreases, then it leads to increase in cardiac contractility. It leads to increase in contractility of cardiac muscles, because I have already told, less extracellular sodium means more sodium needs to be pumped out from cardiac myocyte into extracellular environment, because this is the common principle which is followed to maintain equilibrium. So if sodium has to move out, then calcium has to go in. So ultimately, this will lead to increase in intracellular calcium, which further increases contractility. So I hope it was clear. Till now, I have discussed three parameters which increases contractility. The first is catecholamine action, second is intracellular calcium, and third is extracellular sodium. Extracellular sodium decrease in extracellular sodium will lead to increase in contractility. Increase in intracellular calcium will lead to increase in contractility, and increased action of catecholamines will lead to increase in contractility of cardiac muscles. Apart from this, there are some medications like digoxin. Digoxin is an agent, like it's a glycoside. Mm, it blocks sodium calcium channel, due to which it increases the amount of calcium inside cardiac muscles, because once these sodium potassium it blocks sodium potassium pumps. Digoxin blocks sodium potassium pump. This is the mechanism of action of digoxin. So if digoxin blocks sodium potassium pump, then it will lead to increase in intracellular sodium. So if there, because sodium potassium pumps sodium out, and helps to bring potassium inside to maintain the equilibrium. So if digoxin is administered, it blocks sodium potassium pump, which leads to decreased efflux of sodium from cardiac myocytes, which ultimately increases the amount of sodium inside cell. So this further activates sodium calcium channel, due to which more amount of calcium will be coming in and more amount of sodium will be going out. So this leads to increase in amount of calcium inside cardiac myocyte, this further increases contractility. So all of the following mechanism which increases the contractility of heart leads to increase in intracellular calcium. So this is what happens. This is all about contractility. Now let's talk about preload and afterload. Preload is also called end diastolic volume, and afterload is also called end systolic volume. First of all, let me talk about preload. Um, it is preload or end diastolic volume. It is the volume of blood in left ventricle immediately before systole begins or immediately after the end of cardiac diastole. So this is preload. Greater the preload, greater longer will be the length of cardiac fibers of heart, which leads to increase in stroke volume. There's a law called Starling law, which I will be discussing afterwards. Mm, so mm, if if preload increases, then it increases the contractility of cardiac muscles. Preload. Now let's talk about afterload. Afterload is in diastolic volume. After the blood has been pumped, the amount of blood remaining in left ventricle after the end of systole is called afterload. It's also called end systolic volume. So greater the preload, greater the cardiac output. But greater the cardiac output, lesser will be the afterload. Because if heart pumps effectively, then maximum of the blood volume, which was already pooled in left ventricle, will be pumped, which leads to decrease in residual volume in left ventricle. So afterload decreases if the contractility of heart is improved or increases. So this was all about preload and afterload. Let me tell you one thing. Mm, vasodilators decrease the preload because also vasodilators, arterial vasodilators decrease the afterload. Because if vasodilators are applied or if administered, then it leads to vasodilatation, which decreases the peripheral resistance, which leads to uh, more efficient pumping of heart muscles. Like the cardiac muscles has to face less resistance while contracting, due to which more volume of blood will be pumped. That is the stroke volume increases, due to which afterload decreases. Now let me talk about cardiac oxygen demand. Cardiac oxygen demand can be defined as amount of oxygen needed for the heart to function well. This is called cardiac oxygen demand. Cardiac oxygen demand depends on contractility. Greater the contractility, greater will be the oxygen consumption by cardiac myocytes. Also, um, mm, greater will be the heart rate, greater will be the oxygen consumption by cardiac myocytes. And also, greater the size of the ventricle wall, greater the cardiac oxygen demand. So I have talked about three parameters: contractility, heart rate, and size. These three, if these three parameters increases, cardiac oxygen demand increases. So 18টা জিনিস: contractility, heart rate, and size of ventricle. That is diameter of ventricle. If these three parameters increases, myocardial demand also increases. Mm, Also afterload. Let me talk about afterload. If afterload increases, then the heart has to hold more blood after pumping. So for that as well, the muscle has to spend more metabolic energy to hold that residual volume, due to which the uh, cardiac oxygen demand will increase. So this was all about cardiac oxygen demand. So these are some basic terms: cardiac output, contractility, preload, afterload, and cardiac oxygen demand. I hope you guys are clear, because while discussing the topics in upcoming slides, these terminologies are quite important, and there's an important conceptual link between all these terminologies. So without further ado, let's move on to next one. Now let's talk about stroke volume. Stroke volume, as I have already told you, let's talk about some of the important equations related to cardiovascular system. স্ট্রোক ভলিউম আমি আগে বলছি যে এক বিটে যতটুকু ব্লাড পাম্প করে তাকে বলা হয় স্ট্রোক ভলিউম। সো অ্যামাউন্ট অফ blood pumped by left ventricle in one beat is called stroke volume. So, end diastolic volume is the volume of blood remaining in left ventricle immediately before uh, ventricular systole begins. Now the ventricle now after that ventricular systole happens and it pumps blood. After that there will be another volume of blood which will remain in left ventricle after systole ends. So this it's called end systolic volume. So end diastolic. So if we subtract end diastolic volume and end systolic volume, it will give the amount of blood pumped by heart in 1 minute. So it's stroke volume. Stroke volume is approximately it's around 70 milliliters, as I've already told. Mm, in diastolic volume, it's around 120 milliliters. 120 milliliters. So the approximate end systolic volume is around 50 milliliters. So let's come to ejection fraction. Ejection fraction can be defined as fraction of uh, total fraction of end diastolic volume pumped by left ventricle in 1 beat. It's called ejection fraction. Normal ejection fraction varies from 50 to 60%. That is 50 to 60% of the volume, total volume of total end diastolic volume uh, of total industrial volume, about 50 to 60% of its total volume will get pumped by left ventricle. So ejection fraction is systolic volume by industrial volume. So if you put the approximate values, that is stroke volume makes 70 milliliters and industrial volume it makes 120 milliliters. So it will be giving the value around 60 or 58 or 58 to 60%. So that's all about ejection fraction. Now let's talk about cardiac output. I have already told cardiac output equals stroke volume into heart rate. Stroke volume, if we consider the approximate value, it's around 70 milliliters, and heart rate, if we consider the approximate value, it's around 72 beats per minute. So that will give us around 4.9 to 5 liters. There's a principle called Flick principle. It states that cardiac output equals rate of oxygen consumption by difference in arterial oxygen content by venous oxygen content. Arterial oxygen content minus venous oxygen content is nothing but its consumed oxygen. So cardiac output equals rate of oxygen consumption by amount of oxygen consumed. This it's called Flick principle. This principle is used in labs to measure the cardiac output. Also, pulse pressure. Pulse pressure is nothing but it's difference between systolic and diastolic pressure. It's an important parameter, pulse pressure. Pulse pressure has many clinical importance, like high pulse pressure is found in hyperthyroidism, aortic regurgitation, aortic stiffening found in old age, and sleep apnea. Also, low pulse pressure is found in conditions like aortic regurgitation, sorry, aortic stenosis, because if the aorta aortic opening is stenosed, then ultimately it will lead to increasing total peripheral resistance and decrease in cardiac output. That is, and cardiac output is directly proportional to systolic blood pressure. So, pulse pressure is pulse pressure is found reduced in aortic stenosis. It is also reduced in cardiac tamponade and cardiogenic shock. So, I will review again. Conditions in which pulse pressure increases are hyperthyroidism, aortic regurgitation, sleep apnea, and aortic stiffening, whereas the conditions in which pulse pressure decrease are aortic stenosis, and then cardiogenic shock and cardiac tamponade. Now let's talk about mean arterial pressure. Mean arterial pressure. Mean arterial pressure, it's actually like it's diastolic pressure plus one third of pulse pressure. So approximate, if you consider 120 by 80 as normal blood pressure, then the value of diastolic blood pressure, as I have already mentioned, is 80 millimeter of mercury. Pulse pressure, it will be around 40. So if we apply that in formula, it will be 80 plus one third of 40. It will give us around 93 millimeter of mercury. It's mean arterial pressure. After that, there is another formula for mean arterial pressure. It's cardiac output into total peripheral resistance. Also, there is another formula. It comprises of two-third of um, diastolic blood pressure plus one third of systolic blood pressure, because heart spends around two-third of its total duration of cardiac cycle in diastole and one third of its total duration in systole story. So this was all about the important equations which we will need in discussion of cardiovascular system. Now let's come to Starling curve. Now let me clarify what is Starling's law. Starling Starling laws states that the force of contraction of cardiac muscle fibers is directly proportional to length of cardiac muscle fibers. So if there will be and all these laws are applied only within physiological limits. So within physiological limits, greater the length of cardiac muscles, more will be the force of contraction of cardiac muscle. This is all about Starling law. Starling. So now let me tell you one thing. If the amount of end diastolic volume increases, then it will lead to more stretching of fibers of left ventricle, due to which the force of contraction of left ventricle will increase and it will lead to increased cardiac output. So this was all about Starling law. Also, mm, mm, uh, let me talk about some of the discrepancies of these law. So this law has got a limitation. It states that these laws can only be applied within physiological limit. So you can see here this black line. I hope it's clear. This black line, it's like it's normal physiologic resting state. So if the person or an individual starts exercising, then it leads to increased venous return, due to which there will be increased pooling of blood in heart, which will ultimately increase end diastolic volume. So if end diastolic volume increases, it will lead to greater length of muscle fibers of left ventricle, due to which uh, there will be more stretching of muscles of left ventricle, and the force of this leads to increasing force of contraction of muscle fibers of left ventricle, due to which cardiac output increases. So you can see this blue line. এই ব্লু লাইনটা হচ্ছে যখন উম, কোনো এক্সারসাইজ কন্ডিশনে থাকবে তখন there will be increase in end diastolic volume, or 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 there will be more stretching of muscle fibers of left ventricle, due to which the force of contraction of left ventricle increases. And if as I have already stated, if the contractility increases, then it leads to increase in stroke volume, and if stroke volume increases, cardiac output increases. So this blue line, this blue line represents the normal physiological states in which the force of contraction increases if the length of cardiac muscle fibers increases. So this blue line is a normal physiologic representation of uh, Starling law. Now let me talk about some of the pathological states. As I have already told, Starling law is only followed within physiological limits. If the physiological limits are exceeded, like in conditions like myocardial infarction or heart failure, or let's say if there is use of calcium channel blockers or beta blockers, then it will lead to decrease in active number of cardiac muscle fibers. So if there will be decrease in number of active cardiac muscle fibers, then this will lead to decrease in length of cardiac muscle fibers, uh, or it will lead to decreased stretching. it will lead to decreased effective stretching. And once the physiological limit of the um, cardiac muscle fibers has been breached, they won't be following the normal Starling law, due to which the force of contraction of cardiac muscle fibers will decrease, ultimately leading to decreased cardiac output, uh, which ultimately culminates due to decreased stroke volume. Hmm. So ultimately, if there is, let's talk about myocardial infarction. In myocardial infarction, there is death of cardiac muscle fibers, due to which there is decrease in number of active cardiac muscle fibers. This leads to decrease in force of contraction of cardiac muscle fibers, which further decreases stroke volume, and ultimately the cardiac output decreases. So this was all about. Now this heart this condition of heart failure, it can be potentiated or it can be improved by administration of inotropes like digoxin and dobutamine. Mm, So mm, or we can also administer beta 1 agonist. Beta 1 agonist increases the force of contraction of heart muscles. So here, this brown line, it represents the condition which arises due to improvement of condition of heart failure by use of positive inotropes. This was all about Starling curve and Starling law. I hope you guys are clear. Now let's talk about the last topic of today's class. It's cardiac and vascular function curve. Let's move to the first curve. I will be describing all those curves in detail. I hope you guys are seeing my slide clearly. Uh, this is the first picture. Here we are talking. In this slide, we will be talking about inotropic function of the heart. So let me describe what is inotropy. Inotropy is basically the contractility of the heart. So greater the contractility of the heart, uh, more the inotropic action of the heart. So this is the cardiac output. Uh, so you can see this continuous pink line represents the normal cardiac output in physiologic state. Gradually, as the right atrial pressure increases, cardiac output also increases. Mm, Apart from this, if if there is increase in inotropy by any means, which may be due to administration of catecholamines or dobutamine or digoxin or exercise, this will lead to increase inotropy. So increase in inotropy will lead to increase in cardiac output. So this dotted curve represented by the number this number one increases the state of increased inotropy, which may be due to increased catecholamines or dobutamine or exercise. Also, let's talk about dotted line represented by number two. In this condition, the inotropy of heart has decreased, and this condition arises due to heart failure with reduced ejection fraction, or or it may also arise due to sympathetic inhibition. So these two states, first one which is represented by number one, is it represents the condition of increase in inotropy, whereas the second condition, which is decrease in inotropy of heart, it's represented by number two. So this pink line represents the normal physiological states. If we administer catecholamines or dobutamine or let's say digoxin, or if the individual is subjected to physical exercise, then it will lead to increase in contractility of the heart, which means there is increase in inotropy of the heart. And conversely, if the subject is suffering from heart failure, or if there is sympathetic inhibition. This will lead to decrease in inotropy of the heart. That is, there will be decrease in contractility of the heart. So this pink line, it's a pink line, and the dotted pink lines which run along this continuous pink line, it represents the inotropic function of the heart. Now let's come to graph B. In this graph, we'll be talking about venous return. So in 3, this continuous blue line, it represents the normal physiological venous return. This 3 represents the condition of increased venous return, and this condition of increased venous return, it may arise due to fluid infusion uh, or increased sympathetic activity, because increased sympathetic activity will increase the vascular tone, which leads to increase in venous return. And also another condition called arteriovenous shunt. Arteriovenous shunting will lead to increase in total volume of venous blood, which leads to increase in amount of volume of blood in left ventricle, and ultimately the amount of volume in um, sorry amount of volume in left atrium, which means the venous return has increased. And this number 4, it represents the condition of decreased venous return. So this number 4, it arises due to sympathetic inhibition or administration of spinal anesthesia. Let me describe this process. If there is sympathetic inhibition, or if there is administration of spinal anesthesia, then there will be um, peripheral vasodilatation, due to which there will be increased peripheral pooling of blood, and this will ultimately decrease cardiac out. This will ultimately, sorry, this will ultimately decrease venous return. Also, if there is any condition, if there is any depletion in volume due to any cause, which may be due to hemorrhage, then there will be decreased volume of venous blood, due to which there will be decreased venous return. So condition 3 represents the state of increased venous return, which occurs due to fluid infusion or increased sympathetic activity or increased arteriovenous shunting, whereas the condition of decreased venous return, which is represented by number 4, it arises due to um, a loss of fluid, loss of blood volume, which may be due to hemorrhage or spinal anesthesia, or due to sympathetic inhibition. Now let's come to the third graph. Again, let's this pink line, uh, which can be seen in this graph, it represents cardiac output. And this dotted pink curve, which runs along this solid pink line, this represents the condition of increased cardiac output. uh, and this number 5, this dotted line, which is usually below this solid pink line, which is represented by number 5, it depicts the condition of decreased cardiac output. And cardiac output is inversely proportional to total peripheral resistance. So if cardiac output increases, total peripheral resistance decreases, and if cardiac output decreases, total peripheral resistance increases. So let me talk about this state of decreased total peripheral resistance. If we administer any kind of um, sorry, if we subject if we if we put this subject on the exercise, or if there is arteriovenous shunting, then there will be vasodilatation, and if there is vasodilatation, this will lead to decrease in total peripheral resistance, ultimately increasing the cardiac output. So this number 6 curve represents the condition of decreased cardiac output, whereas the another curve, which is situated below this, which is represented by number 5, uh, it leads to condition of increased total peripheral resistance, which occurs due to administration of vasopressor. So whenever we administer vasopressor in a subject, it leads to vasoconstriction, and vasoconstriction leads to increase in total peripheral resistance, increase ultimately decreasing the cardiac output. So this was all about for today. I discussed several parameters related to cardiovascular system. These topics and concepts which I covered in today's class would be quite important for understanding and grasping the concept of uh, other topics in future. So লাস্টলি আমি হচ্ছে আপনাদের সবাইকে ধন্যবাদ জানাতে চাচ্ছি যারা যারা আমার এই লেকচারটা শুনতেছেন বিভিন্ন জায়গা থেকে, হোক বাংলাদেশ থেকে হোক, না হলে নেপাল থেকে হোক, না হলে অন্য কোনো দেশ থেকে হোক, আপনারা যারা শুনতেছেন পেশেন্স নিয়ে, আপনাদেরকে অনেক অনেক ধন্যবাদ। এবং হচ্ছে আমি আবার কৃতজ্ঞতা জানাতে চাই অ্যাক্সিস মেডিকেল পরিবারকে আমাকে এই আহ, এই সুযোগটা দেওয়ার জন্য, এই প্ল্যাটফর্মটা দেওয়ার জন্য। থ্যাংক ইউ সো মাচ। Thank you so much for listening patiently. We will be continuing the another topics related to physiology of cardiovascular system in upcoming classes. I will be taking 3 classes related to physiology of cardiovascular system. This was the first one. I will be taking 2 more classes in days to come. Thank you so much.